Up next on Primary Care, sickle cell disease. About 100,000 Americans have the disease, and the majority are African American.
It's not just a black thing, but it is a black thing. And the fact that it is a black thing has been a problem for us.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the show dedicated to the health and care of African Americans. Sickle cell disease was once believed to be contagious, but it's actually an inherited blood disorder that affects around 100,000 people in the United States and millions worldwide. In the 1970s, someone born with sickle cell disease lived an average of 14 years. Today, the average life expectancy is 40 to 50 years. Sickle cell can strike people of all races and all ethnicities. The great majority in the United States are African Americans. In fact, 1 in every 365 African American babies born is diagnosed with sickle cell. Here to talk with us about sickle cell disease and dispel any myths that you may have is Dr. Wanda Whitten-Shurney. Dr. Shurney is the CEO and Medical Director of the Sickle Cell Disease Association of America, the Michigan chapter. She is also a pediatrician at Children's Hospital in Michigan, and for more than 30 years has specialized in the treatment of children with sickle cell disease. Dr. Shurney, welcome to the show. So glad to have you.
It is a pleasure to be here.
It's an honor. I cannot start this show off today without paying kudos to your father, who was a mega icon in this community for people like myself and so many others.
So
Dr. Charles Whitten. Dr. Charles Whitten, he meant so much not only to the physician community, but the community at large in various aspects and what he chose to do with his life. We sorely miss him, but he passed the baton to the proper hands for you to continue.
And listen, I am trying to carry on his legacy, but when people tell me I'm following in his footsteps, I take off my shoe and hold up my foot and say, wait a minute, my foot is not that big. Yeah, my father, he felt as though we weren't using the information that we had about sickle cell disease to benefit the community. And he also felt like patients at Children's Hospital who had cancer were getting comprehensive care, and patients with sickle cell disease weren't. So that prompted him to start the National Association for Sickle Cell Disease, which is now the Sickle Cell Disease Association of America. He started the community-based organization right there on the Lodge Freeway. People say, oh yeah, I've seen that building. You know, it's been there since 1970. The bus, yeah, really want to talk about that bus. Nice. And also the Comprehensive Sickle Cell Clinic at Children's Hospital, where I've spent 30 years doing outpatient care as a general pediatrician for kids with sickle cell disease.
Good. Well, congratulations on all the work that you've done and continue to do. Why don't you help us dispel some of the myths about sickle cell disease that might still be existing in the general population?
All right, good, good. You know, that one about it being contagious is still a big problem. And actually, our inaugural walk in 2014 was what we called a myth-dispelling walk. And so we had individuals living with sickle cell disease wearing the t-shirts that bore some of the myths. And one was, I'm still here living with sickle cell disease, because of the myth that everybody dies by the time they're 21. You know, one of my sheroes, Shirley Miller, she waited to start her life until she was 30, because all she could hear was, you have sickle cell disease, you're gonna die, you're gonna die. So she spent her whole life waiting to die, you know? And then it's like she woke up and she said, I'm alive and I'm 30, and she got a master's degree, and now she's a patient advocate in North Carolina. You know, so you're gonna die by the time you're 21 is one that we've got to get rid of. We have people living into their 70s now, okay? But the average lifespan is around 50, right, okay? So we're doing better. The problem is people are living longer, but we need to help people to live better. You know, as you know, sickle cell disease affects every organ in the body. You know, so as you age, then you have kidney problems, and you have liver problems, and you have heart problems and lung problems. So we don't just want our patients to live longer, we want them to live better. Okay?
So the comprehensive approach is something that needs to be readjusted according to age group. Like any other disease that we approach. Why have we left sickle cell behind in this conversation?
Okay, so if I say that a part of it isn't racial, then I would be lying and ignoring a big part of the problem, okay? If we kind of get back to the myths, that it only affects black people. That's what people, you know, one of the women in our walk is Arab American. She wore the t-shirt, "Is not just a black thing," okay? So, and when she talked, when she came to the microphone, she talked about how when she tells people she has sickle cell disease, that they look at her like, what? You know? And so it's not just a black thing, but it is a black thing. And the fact that it is a black thing has been a problem for us, you know, and I think that a lot of the issues that come up in terms of funding for research and in terms of care and in terms of the way that patients are managed in the hospitals, it has to do with the fact that it's predominantly an African American.
So a person of another ethnicity would be a victim of a lot of the complications that we have in treating patients with sickle cell.
Absolutely.
She's not African American, but she's a victim of our approach or lack of approach to treating the disease in modern times.
Yes, yes. And so another t-shirt in the walk was, "My pain is real," because the hallmark of sickle cell disease, as you know, is unpredictable, indescribable pain. But yet and still, when our patients go to the emergency room, they're accused of being drug-seeking, drug addicts. They want the narcotics so that they can sell them. They want the narcotics so that they can get high.
30 questions before treatment.
They want the narcotics because they're in pain, okay? And that's what we have to treat pain now, is narcotics. In 2017, we got our second medication to treat sickle cell disease. All we had for 20 years was hydroxyurea. Right? Hydroxyurea is a chemotherapeutic agent, right? It was used to treat cancer. Our patients would say, "I don't have cancer, I don't want to take that." We think that only about 20% of people that could benefit from hydroxyurea are actually taking hydroxyurea.
So we're missing the mark.
We're missing the mark.
We're not getting the available treatments to the place where it can do the most good.
Yes.
So the pain aspect of it has always been an issue because of the frequency or the exacerbations that these sickle cell patients will suffer through. And basically they get labeled more than just drug seeking. A lot of times nobody believes that the other sequelae of the disease is even present, especially in urban emergency room.
Yes, and I think that what needs to happen is that patients need to be believed. You know, make the assumption that the person is in pain and treat the pain. And then if you find otherwise, because mind you, the incidence of drug addiction in the sickle cell population is not zero. It's not zero in any population, okay? But let's not make that the assumption, okay? Let's first look to treat the pain.
So we still have a lot of work to do.
We have a tremendous amount of work.
Just in the initial encounter in dealing with a sickle cell patient.
Right.
That's interesting because the disease state is not new. It's not like a lot has changed in terms of presentations. Like you say, first drug just recently that takes us to another level of treatment. We've got some catching up to do in the whole assessment, treatment, and hopefully improving outcomes of sickle cell patients.
And we're going to do that catching up. That's happening now.
Dr. Shurney, we're up against a break, but we'll be right back with more discussion on sickle cell disease. Coming up on Primary Care, you'll hear from a mother who no longer is in fear of her son's sickle cell diagnosis.
Some people stereotype with kids or people with sickle cell is down all the time, tired all the time, sick all the time, and that isn't the case for us.
1 in 365 African Americans battle sickle cell disease. I was one of them. Life back then was painful. I was in and out of the hospital and had frequent pain crises. A blood stem cell transplant is the only cure for sickle cell disease. I was fortunate to find a perfect match in my younger sister, but many patients do not have a compatible donor in their families. And Black patients have only a 23% chance of finding an unrelated donor. More Black donors are urgently needed to help save lives. It only takes a simple cheek swab to join the Be the Match registry. Learn more about becoming a donor and access free patient resources by visiting endsicklecell.org today. You or someone you know could be the cure for a patient battling sickle cell, like me.
Kendra Brown was devastated when she was told her son Landon was born with sickle cell disease. 6 years later, she learned that Landon and other children born with the disease can live long, healthy lives. We caught up with this mother and son recently at the Sickle Cell Walk in Detroit.
When we first got the diagnosis when he was born in 2013, I was totally devastated. It was like a heartbreak that never goes away, all the way up until now. The first year was really tough for us. He had a bunch of things associated with sickle cell disease, like dactylitis. He had splenic sequestration. So he was in the hospital like every 2 weeks. Then he got on a drug called hydroxyurea, and it was a total lifesaver. Just last week, though, he was hospitalized for his first time in maybe 2 years with something called acute chest syndrome. And it's like pneumonia in the lungs, and he was there for a week. But that has been the only major issue that we've had since he's been on hydroxyurea. I always associated with sickle cell disease with death. So I always assumed that when you had sickle cell, you would die early. And because my mother didn't know much about it, so she would just say, make sure you don't have a child with someone who has the actual trait, because you could have a child who could die young. So that tormented me. So I'm like, oh God, that means he's gonna die. He's always gonna be sick. And I know that's a little harsh, but that's just what I associated it with. So as we progressed and as he got older, Dr. Shurney would reassure me that that wasn't the case, you know? And even still, he has his little bouts with the disease. This is what he is. Full of energy, full of life, and I couldn't have asked for a better child with that, with the sickle cell disease. It's like, you know, you have a stereotype. Some people stereotype with kids or people with sickle cell is down all the time, tired all the time, sick all the time, and that isn't the case for us. Now, he does get sick. I'm not saying that he doesn't, but he's always in good spirits, even when he is sick. Don't just assume when you see a child or a person, you don't have to feel sorry for us or us as parents or the child, because we can live long, we're strong, they're strong, and I think it makes us even stronger, makes them even stronger, because makes them a lot more brave. So it's just an experience that I don't think anybody will understand unless they've had an experience like this, you know? But
and
yeah.
God gave us all this.
For a reason.
For a reason. And so we can protect our lives, our children, our families, everybody. Everybody's we love.
Dr. Shurney, this is certainly a special young man and a special mother.
Absolutely.
Who has come a long way in understanding her child's disease. Right. Tell us about this interaction, this interplay, mother, son, and the disease, that triangle.
All right. So as you know, every baby born in the United States is tested for sickle cell disease at birth. And in Michigan, it's the Sickle Cell Disease Association of America Michigan chapter that has the responsibility of informing the mothers of the diagnosis. And so here's the thing. A lot of times in the Detroit metropolitan area, I'm the one that picks up the phone to call the mom, right? I called Nakendra to tell her that Landon had sickle cell disease. And here's the issue. This is what happens most of the time. The mom says to me, well, I have sickle cell trait, but the baby's father doesn't. So there's no way that my baby has sickle cell disease, right? And so I say to her, well, how do you know the father doesn't have it? And she says to me, because I asked him. Because
not testing.
I asked his mother. Bonk, wrong answer, right? Because it doesn't cause sickle cell trait, where you only inherit one sickle gene, doesn't cause health problems. Right. Sickle cell disease, when you inherit 2 sickle genes, is when you get sickle cell anemia, which is what Landon has. And so the way we were able to get newborn screening in the first place is there was a landmark study published in June 19, 1986 that proved that giving penicillin twice a day would be life-saving. So when people like my father advocated for newborn screening, they would say, well, Dr. Whitten, what are you you going to do if you have the diagnosis? And he'd say, we educate families. And they say, no, education isn't enough. You have to have an intervention. So when it was proven that penicillin was life-saving, then we had the intervention, we were able to do newborn screening. And that's a really good thing, but it used to be that people would go from doctor to doctor to try to figure out what's wrong with my child. Why is my child's eyes yellow? Why is my child crying all the time? And then when they finally got diagnosed with sickle cell disease, it was almost like a relief. You know, instead is Dr. Wanda Whitten-Shurney calling you on the phone saying, did you know that babies are tested at birth for sickle cell disease? No, I didn't know that. Your baby has sickle cell disease. No, okay? And so I really feel like, Lonnie, that sometimes parents go through the stages of death and dying when they get a devastating diagnosis like that. And of course, the first stage is denial. You know, and so I'm trying to get them on life-saving penicillin, and they're denying the fact that the baby has, and they're just afraid. So education is a big part of it. You know.
Yeah, it starts basically with this particular case with Landon, the difference between trait and disease, and how do you actually acquire the disease.
Right.
I mean, and a lot of the public, even after all these years, still don't understand those basic differences between this whole scenario about sickle cell.
Right. I mean, some people think that sickle cell disease doesn't even exist anymore.
Right.
You know, so
and
here we go with awareness. Yeah, but the difference between the trait and the disease is important. And what, you know, the first mission of the Sickle Cell Disease Association of America Michigan chapter is to maximize the quality of life of individuals with sickle cell disease. But secondly, we also want to help individuals who are at risk for having a child with sickle cell disease, that is, they have sickle cell trait, to make informed decisions about having children. So it's not to say if you both have sickle cell trait, you shouldn't have a baby, or if you both have sickle cell trait and the mother gets pregnant, you should have prenatal diagnosis and you shouldn't bring the baby into the world. It's none of that. It's just knowing ahead of time the challenges that you would face if you have a child with sickle cell disease, so that you're prepared, so you're not shocked when someone picks up the phone with the newborn screening diagnosis.
Absolutely.
So
you've had time to mull over the ins and outs, some of the ability to ask questions, get answers. That is always valuable in treating any disease state. Why the prevalence toward African Americans? Help the viewing audience understand that.
Okay, so the thing is, having sickle cell trait protects you from malaria.
Exactly.
Okay, so basically you should see sickle cell disease anywhere you see malaria. Okay, because people would survive who had the trait, and then they would go on to have children. But then unfortunately sometimes they would get both sickle genes and they would have a child with sickle cell disease. So then you might ask yourself, well, there's no malaria in the United States, so why do we have sickle cell disease in the United States? And wherever you see sickle cell disease where there isn't any malaria, it's because of migration. And in the United States, it's because of the forced migration of the slave trade.
Exactly.
So when they brought us over here to build this country for free, and then tried to pretend like it never happened, then we brought our sickle cell genes with us when we came.
So understanding a disease state like sickle cell really sheds a light on other social issues that we have that still exist in this community today.
Yes, yes.
We're up against the break again, Dr. Shurney. We'll be right back with more primary care.
1 in 365 African Americans battle sickle cell disease. I was one of them. A blood stem cell transplant from a perfectly matched donor saved my life. Many patients are waiting to find their match. They need more Black donors to join the Be the Match registry. Learn more about becoming a donor and access free patient resources by visiting endsicklecell.org today. You or someone you know could be the cure.
Welcome back. We're here with Dr. Wanda Whitten-Shurney, CEO of the Michigan Sickle Cell Disease Association of America, and having an outstanding conversation on what a lot of people consider to be an old disease, but it's very new.
Yes.
It is still alive and well. We saw the interview with Landon, the 6-year-old patient. How is he doing? How is he adjusting at such a young age? How's his mother and the family doing?
Yeah, you know, Landon is doing really well. He's on the first disease-modifying therapy we have for sickle cell disease, which is hydroxyurea. He started it when he was a year old. And in his first year of life, he had a number of complications from sickle cell disease. He had blood getting trapped in his spleen, requiring blood transfusions. He had pneumonia. He had multiple pain episodes. He had swelling in his hands and feet, which we call dactylitis. And we started him on hydroxyurea. And since then, his disease disease course has been a lot more mild, you know, so that's really helped a lot. I think the other thing that is helpful is the education process, you know. So when we call the mother to tell her that the child has sickle cell disease, then we invite the family in for a series of 2 educational sessions so that they can understand and anticipate the problems that might arise, and we help them to understand what's the best way to help their child live the best life that they can live. So we were able to do that, and Nikki was very engaged and came to the education sessions, asked lots of questions, and then when they enroll at the comprehensive sickle cell clinic at Children's Hospital, we try to make sure that they're learning something with every visit, you know. So we try to, and one of the nice things about that clinic is that it's one-stop shopping. We do your general pediatric care and your comprehensive sickle cell care all at the same time. And it's an exceptional family. He's a really bright child. He asks really good questions when he comes to see us, and we're hoping he's just going to continue to do well.
Very good. So the one-stop shopping is important in a situation like this, simply because of all the variables that exist around the disease itself. It wouldn't be fair to try to treat him in a microcosm state. Okay, you got to address everything.
Yes.
The time off work, travel, the whole 9 yards comes into play, and it's so good to hear that the center provides that type of comprehensive approach to the treatment of sickle cell disease. What is the role of the primary care physician in this disease state?
So what we want the primary care docs to do is to try to help keep the patient as well as possible. So take care of all the other things, you know, and it's not just like, this is, and one of the words that they don't like in the community is a sickler. You know, this is a person who has sickle cell disease, you know, but we were talking about the one-stop shopping at Children's Hospital. You know, there's a huge issue in sickle cell disease with transitioning to the adult side, okay? So when patients become an adult, all of a sudden, the doctors aren't interested, particularly primary care doctors. It's a very complicated disease, both medically and psychosocially, you know, and so sometimes it's difficult to find doctors to take care of patients. I've had adult patients call a hematology practice and say, I'd like to make an appointment to come in, and they say, what is your diagnosis? Sickle cell disease. We don't see patients with sickle cell disease. So they see every other, they see hemophilia, you know, but they don't see patients with sickle cell disease. Well, why, you know? So one of the things we're working on is trying to make the adult clinic in the University Health Center a one-stop shopping where we can have primary care and really do comprehensive care to help these patients stay well. You know, I think that really the future is bright for sickle cell disease because now there are a number of pharmaceutical companies that are doing clinical trials in the sickle cell space, and we're anticipating at least 2 new drugs probably in early 2020. So I think the treatment is going to get better, but what we have to do is we have to keep the patients alive for the cure. I've been to 4 funerals in the past 6 months, you know, and I'm a part of the National Institutes of Health Advisory Committee, and there's the Cure, Accelerate the Cure initiative for sickle cell disease. So they're thinking they're going to have a genetic cure for sickle cell disease within the next 5 to 10 years. You know, so that is just, that's got everybody really excited. But once again, it's the quality of life of the individuals now until we get to the cure.
Right. Getting them to the point of treatment that really can make a difference. Right. Are there any particular areas that we should be aware of in terms of a sickle cell patient? Are there any problems that would be germane to the female population who may have the trait or the disease in states like everybody wants to say, listen, this drug has a black box warning, you can't take it if you get pregnant. Are there any particulars like that that we should be aware of when it comes to sickle cell disease, basically in the female population?
Okay, so there are a number of issues with female patients with sickle cell disease, and one that I really learned about when I was caring for adolescents is that a lot of times they have pain, sickle cell pain, along with every menstrual cycle, you know, so that's a problem. The other is that once they become pregnant, it's a high-risk pregnancy, okay? And then we know that the child is at least going to have sickle cell trait, so one of the things that we want to know is, does the partner have the trait also, and are they at risk for having a child with sickle cell disease?
Even after all these years, we still need to do something to educate the community better about this disease. How do we increase the awareness in the African American community in particular, and the community, in the larger portion of the community?
Well, that's something that we're working on at a national level, and of course that's something that I'm constantly working on at a local level here. And you mentioned when we were talking earlier about that bus that my father had, okay? So there was this mobile unit. It was actually a school bus that he had turned into a laboratory, right? Where you actually would get on the bus, get your finger poked, and get your test result right then. And if it was positive, you had to get back on the bus and look at a PowerPoint presentation with my dad explaining, you know, the significance of having sickle cell trait. So one of the things that we're really looking to do is to obtain a vehicle that we can wrap. You know, you see the buses wrapped in pink for breast cancer awareness, and something that, because people will frequently ask me, whatever happened to that mobile unit, you know, and if I think we could have that driving around the state, that would help. You know, we have a walk every year. We had 100,000 people at our inaugural walk. We were at the Museum for African American History last year. We had 500 people, you know, so we're trying to really get the word out.
And I'm sure you know this, not only in our local African American Museum here, but in the National African American Museum in Washington, D.C., there's an outstanding display of Dr. Whitten and his work with sickle cell disease, and pictures of the bus and the clinic. I mean, it's very outstanding.
And
it's
I haven't
something
made
to be proud
it there
of.
yet, but I'm on my, I've got to get there.
I've got some pictures somewhere.
Okay, great, great,
great,
okay.
great.
Yes.
We've been talking with Dr. Wanda Whitten-Shurney, who is the CEO and Medical Director of the Sickle Cell Disease Association of America. Wanda, thank you so much for being with us. This has been an outstanding discussion, and we hope to do this again. Okay, thank you so much. Great. There's no cure for most people with sickle cell disease, but treatments can relieve the pain and help prevent problems associated with the disease. Those who have sickle cell disease can live a full and active life by learning how to stay as healthy as possible. It starts with finding a doctor who specializes in the disease and one you can trust. For Primary Care, I'm Dr. Lonnie Joe. Thank you for watching.